Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
all the drugs are used in the treatment of congestive heart failure except we can use nitroglycerin, spironolactone and nesiretide in congestive heart failure, whereas trimetazidine is actually used for angina pectoris, not in congestive heart failure. Digoxin toxicity is increased by renal impairment, yes; hyperkalemia, yes; hypomagnesemia, yes. It is increased by hypokalemia, not by hyperkalemia. Digitalis toxicity is increased by hypokalemia. Then digitalis toxicity is increased by hypokalemia, quinidine, renal failure, hypomagnesemia, verapamil, and calcium thiazides. Digoxin toxicity is increased.
thank you and thank you for watching.